Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop herniated disc pain or bulging disc pain. But before I do that, we need to understand what is herniated disc, the causes, the symptoms, the risk factors, because that will guide us and help us to really get to the root cause of the problem and stop herniated disc pain. So first, what is herniated disc? So as you can see here in this image, so the disc that between your spinal vertebra, it has two components, and you see here the green part that's called nucleus pulposus. That's a gel-like tissue that's very soft. That's in the center of the disc. And you have in the outer layer of that disc, as you see here in the normal disc here, it's called annulus. And that's a kind of like encapsulated tissue that hard, tough enough to keep the cushion inside in place intact. So in herniated disc, what happened is part of the annulus here start to crack or lose its toughness, so the disc start to bulging and pushing on the nerve, as you see here in this image, and this is a side view for it. So let me show you in the model I have here. All right, so we have the vertebra and we have the disc in between. So this is a normal disc, there's nothing coming out, and you have the nerve coming out from both ends, left and right. So when you have herniated disc, you will have a part of the disc is taken out and it's actually compressed on the nerve. And when that happens, it causes radiculopathy, like nerve pain, sharp numbness, tingling, and sometimes weaknesses. And that's basically what herniated disc, it's just bulging on the nerve. The thing that actually looked by a lot of healthcare providers, that based on the studies, most of the people have herniated disc. That does not mean your symptoms from the herniated disc. So make sure you watch this video to the end to get to the root cause of the problem, because sometimes it's not only disc, there's other issue involved. And sometimes you have sciatica or back pain or lower leg pain, because there is issue with the healing cycle more than the disc issue. But I'm gonna go over the treatment for the disc if you have a pure disc issue in this video. Okay, so what are the risk factor and the causes for herniated disc? So the herniated disc could be caused by low back injury, and that's usually happen from repetitive motion, including lifting with twisting, poor body mechanic. You could injure your disc. Also, overweight, that's a risk factor to have disc issue. Another thing is risk factor actually is the truck drivers. So if you drive truck for several years, because the vibration of the trucks, that would actually cause degeneration in the disc. That's what cause wear and tear on it. Risk factor is weak core muscle, so you're not really maintaining proper posture like this. So you actually wearing your disc on one side, and that could cause tear by poor posture. And your core is weak, so you really depend on your disc and your vertebra to maintain you upright, so you don't fall forward. That increase your risk of having disc issue. Job requires heavy lifting for prolonged period of time, poor lifting mechanics, diabetic. If you have osteoporosis in the back, which is wear and tear in the vertebra, as you see here, this is normal vertebrae. Smoker and sedentary lifestyle, those are risk factors. So how we treat herniated disc? In order to answer this question, we need to understand the normal healing cycle, so we really get to the root cause of the problem. So normal healing, The body has to go through three stages in order to heal. I'm just gonna use external paper cut for visualization, but the same process happens internally when your disc is herniated. First stage is inflammation. Swelling, redness, the blood starts to rush to that area and you start to have pain and decreased function. Second stage of healing is proliferation stage. So when you have any internal or external cut, your body has to build a scar tissue. That is part of healing. The problem is when you have too much scar tissue in the way of everything else, that actually will cause more pressure on the nerve and cause nerve pain. So during the proliferation stage, there is a cascade of events: fascial restrictions, muscle spasm, trigger points. So during the end stage of healing is the maturation stage. That's when the body starts to clear up everything in the proliferation stage and the inflammation stage, and your body just dissolve all the scar tissue and decrease the inflammation as here. If you have a chronic condition, your body probably going back and forth between inflammation and proliferation. So how to address that? Before I go over the treatment, I will go over what currently been used that actually does not work on addressing the root cause of the problem, so you don't have to waste your time on it. So what I have learned in the school, we use the ice, and that's temporary decrease in the inflammation, but does not do much for the proliferation stage and really get to the root cause of the inflammation. Electrical stimulation, it's temporary pain relief. It's not going to break the scar tissue. It's not going to do much to the inflammation. So the other thing used by a lot of therapists or athletes is foam roller or massage. The problem with that is the foam roller, if it's an inflamed area and you rub against it with the foam roller or doing massage, that's going to cause more inflammation. The other issue is, based on the studies, foam roller does not provide any long-term pain relief. It's temporary, and the same thing applicable to massage. When I go over the normal healing and the fibrosis and the scar tissue, it will make a lot of sense why massage and foam roller is not going to address the root cause of the problem. So massage and foam roller are actually going to cause more inflammation, which herniated disc, a lot of the time you will have inflammation here. It might cause more inflammation, so it actually could cause more symptoms. So the other thing that's been used a lot is stretching, and that's a problem because if you overstretch, you're going to cause more inflammation. And studies showed actually stretching could cause inflammation. And that's why I have a video why you should not stretch. Make sure you check that out. If you're stretching, there is a high chance you're going to make your symptoms worse. So the other thing is doing strength exercises, and I usually do that, but I don't do it during the inflammation stage, because if it's inflamed, it will inflame it more. There's much more important approach than strengthening exercise, which is actually the core stabilization. That's more important, and proper body mechanic for lifting, for sitting, for standing, because those actually the trigger for having disc issue, not the strength exercises that will get to the root cause of the problem. So how to treat it? We really need to look at the body from the healing cycle and figure out, are you purely stuck in the proliferation stage, or you actually going back and forth between inflammation and proliferation? We have to address that cycle from both ends to really break it down. So what I personally use for the inflammation is, if you are in acute stage of herniated disc, 5-7 days of rest, just take it easy, don't do lifting, just take it very easy. That should be good enough to really help to decrease that inflammation. If that's not enough to really get your inflammation under control, you probably have moderate to severe inflammation. And with those patients, what I usually do, I use a MagnaHeal. This is MagnaHeal 2, and the magnetic field is about 3 inches force depth that can be penetrated in the body. So that's what I have patient use it in herniated disc area, they just wearing throughout the day or wear it at night to decrease localized inflammation. The other thing I put my patient on is the anti-inflammatory diet. Certain food actually could cause inflammation in your body, like refined carb, refined sugar. Based on the study, it actually put your body in inflammation for about 5 hours after eating. So if you eat 3 inflammatory meals a day, your body in internal inflammation for 15 hours. So I'd like to put all my patients on anti-inflammatory diet. We'll have some tips about that diet in the future videos. So the other thing that's extremely overlooked by a lot of healthcare provider is deficiency. Your body need, for example, vitamin D3, magnesium, zinc, C, Bs, to transition from inflammation stage to proliferation stage to maturation stage. If you have any deficiency in certain vitamins and minerals, your body will never be able to transition in the healing cycle, and you're going to be going back and forth here. And there is several studies shows low back pain could be related to vitamins and mineral deficiency. So if you have chronic condition and your body's not healing, one of the things that need to be done is figuring out if you have deficiency. So feel free to check Ask ASTR. It's a free online medical evaluation. You just go to askastar.com. It takes about 5 minutes, and the software will evaluate potential vitamins, mineral, or hormonal imbalance, and it will give you steps on what you should do to really take care of those issues. The software is actually including at least 9 healthcare provider database, so it's a very comprehensive way to really help you to figure out why you could have issue, and it's free. So the other thing we have to work on simultaneously is a proliferation stage to really break that vicious cycle. So when I work on a proliferation stage, I have to work on everything here. If you pick and choose, you're not really breaking the whole vicious cycle. So I work on the scar tissue with the trigger points with the A3 first. That's what I use to break the superficial scar tissue. And I use the A5 to work deep to break deep scar tissue and trigger points. And that's why foam roller and massage are not effective, because they're not gonna go deep enough to really break deep adhesion. And if you cannot go deep enough and exerting mechanical force, it's impossible to release those adhesion. I will go over the fascia system briefly here, but it's very important overlooked issue that very essential for treating the herniated disc or back pain. And you will understand that why when I go over the next few slides. So the fascia system, the superficial, is like a wrap surrounding the entire body. It's a very thin layer wrapping the entire body. That's a superficial layer. And you can see it here, actually, the white web tissue, that is actually the fascia. And you see it in the second image and the third image here. So to make it very complicated, but don't worry, the treatment is extremely simple. But I want you to understand how complex the fascia system, so you appreciate the treatment and the significant effect of the treatment on the body. So the fascia system divided to 2 categories: superficial layer and deep layer. The deep layer is divided to 4 subcategories: the apparatic fascia, that wrapping a group of muscles; the epimysin, you can see it here, wrapping each individual muscle fiber. Then you have the premiysin, that wrapping a bundle of fibers, and the endomysin, wrapping each individual fiber. So, and each of those layers actually have 2 to 3 sub-layers, so they are on the top of each other. So 2 to 3 apparatic fascia layers, 2 to 3 epimysin. And that's why it's not possible with the foam roller or the massage to really go deep, because mechanically with the massage, like the knuckle or the elbow, it's impossible to go deep to those layers. That's why I use the A5 to really go deep. And if you cannot exert mechanical force to release the fascia layers, it's not possible to release it. So what I personally do is I use the A1 to release the superficial fascia layer and release the apparatic fascia layer. Then I go deep to release the deep epimysin, premiysin, and endomysin layers. So to summarize, what should you do at home to really work on herniated disc? First of all, what you can do if you are in acute stage, just rest. 7 days should be good enough if it's a mild condition to get your pain under control and get back to normal. During that time, you need to avoid any lifting so you don't make it worse. The other thing, if you have that risk factor, you have to do core stabilization. That's much more effective than strengthening or stretching exercises. So we have to stabilize the back. I have other videos on our core stabilization and posture. Feel free to check out those videos. The other thing is you need to avoid lifting. If you have to lift, make sure you follow the proper lifting body mechanics. So I will have a video in the future about that. Just make sure to subscribe to the channel to get notification about this video. For moderate to severe herniated disc, we have to break the vicious cycle from both ends. The inflammation, because internally there's a lot of inflammation. You can see it here in this image with the herniated disc. At the same time, there's a scar tissue around this area, and you don't see it here, a scar tissue in the muscle and the fascia that surrounding the spine that compress on the spine and make a lot of pressure on the disc. So what I do, I work on inflammation and proliferation stage, use the MagnaHeal anti-inflammatory diet, and if you have severe deficiency or chronic condition, check Ask ASTR to really figure out what possible vitamins and mineral deficiency that could be inhibit or prevent your body from healing. At the same time, we need to release everything, the scar tissue, the fascial restrictions, the muscle spasm, while we actually stabilize the back and correcting the posture to decrease your risk of having this issue in the future. Herniated disc, it's common misperception that all the back pain is herniated disc. There's several studies shows most of the people has herniated disc, but that doesn't mean your symptoms from herniated disc. So make sure when you address it through the healing cycle to really get to the root cause of the problem. So if you have any question or comment, leave it in the comment section below and I will answer it in the future video. So I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.